I know everybody knows what COVID is. COVID has caused a bunch of damage to all of us, either by the loss of a family member, damaging our own bodies, causes businesses to shut down, social outbreaks, and people to just become unemployed as a whole. My topic is on the Right to Health Action, which is a group that is fighting to gain some type of leverage on COVID-19 to make sure that people have the rights to health and a safer environment to be a part of. They started this by the conversations that was going on between veterans, frontline health workers, and scholars. During the pandemic, they came together with a lot of anger from facing yet another pandemic and were committed to have a precise action to stop COVID-19 and prevent anything that is from happening again in the future. They created a plan to use the moment to make room for a different change in the world. At the same time, they needed to develop new tactics for training and action for the virtual world. This is a 50-state group. The members are from different communities that has been affected the most by COVID-19. The Right to Health created a People's Pandemic Prevention Plan to enact a global fund to stop the outbreaks, promote universal health care, and stop deforestation and climate change from happening again. The plan has also had a public health program to fight the racial health differences that's going on right now in the world. The Right to Health also wants to make sure that everyone is well funded. Vaccines and medicines are free for everyone at any place at any time. They also want us to stop the irresponsible practices on the supply chains that contributes to a tropical disease spillover. They also have leaders that have been in the group for decades and was also with companions to end the AIDS and tuberculosis. These members feel provoked because they are now in another predictable and preventable global catastrophe made by leaders that were making denialist policies. Today, the World Bank ratified a historically new global financing mechanism to prevent and prepare for pandemics to come. The Right to Health Action is the nation's largest COVID group. They fought for this since the start of the pandemic. The Biden administration plan is also for pushing a global fund to pandemic-proof the planet. Near the finish line with vital support from Indonesia's president, but the group also criticizes the World Bank's START exclusion for low and middle income countries, as well as frontline civil society organizations. They condemn the bank's potential focus is containing the spread of the diseases after an outbreak has already happened and neglect the additional action to prevent outbreaks from happening in the first place. The Right to Health wants to fund and serve as a pooled funding pot to which countries and civil society applies in most cases jointly. You have to be provided to implement comprehensive national country pandemic prevention plans, but money is primarily directed towards the local community groups and the public sector rather than other agencies or development banks. The pandemic fund should include an equal number of donor countries and low and middle income countries as well. With the addition to protect seats for civil societies representing the NGOs from the North Global and South Global, as well as the board seats for the people and stigmatized populations. The inclusive board seats should also be in place from the beginning in the design stage rather than the observers or the advisors brought in after the scope of work has already been set. The fund should also invest and bring a scale proven for the pandemic prevention models that has demonstrated sleep reductions in spillover risk and had an enormous payoff in the community health, poverty relief, and carbon conservation simply from providing jobs and health cares for communities in tropical forests. The fund should also provide for regulations and a commercial wildlife trade and markets, as well as the protection for tropical forests in the top 500 zoonotic spillovers hotspots. Adapting from this, the measures from Brazil used to reduce deforestation and roughly commensurate the risk of spillovers by 70%. Pandemics emerge from uncontrolled diseases, outbreaks, causes of overwhelming and a spillover from the wildlife to humans. Spillover events are accelerating and intensifying as tropical forests are destroying to attract profitable raw materials and often displaying people from different lands to process this going on right now. I would highly encourage everyone to at least think about joining the R2H action movement.